Sometimes, if you really wanted to speak to the doctor that you've gone through from the start, I wonder if that will carry on.
If you want a normal appointment, you can wait up to 2 weeks. If you're going to be ill, you just have to sort of book in advance to be ill, if that makes sense.
People like me are getting older, so we're obviously going to need the A&E, aren't we?
If it's not an emergency, don't overburden your A&E department.
It's the waiting. Yeah, the waiting is crazy.
If you had somebody you could consult, you probably wouldn't need to keep going to A&E.
Well, everyone's paid into it, so everyone should get care when they need it.
Stay in your home, obviously one would prefer to stay in a home, than actually have to go into hospital.
Put more money into the recruiting, I think.
I think organisation and funding is definitely the key here to be able to help out.
Medicine has changed massively since I've been a GP for the last 20 years. It's changed from people having quite straightforward problems to much more complicated, complex problems such as diabetes, asthma, COPD, numerous problems that mean that we have to spend longer with our patients. East Kent's a very large area and quite a lot of it's rural, and so travelling times can sometimes be quite long for people to go to hospital for something that would often seem quite straightforward. So what we're trying to do over the next few years is to structure our healthcare and care system in a way that means people don't have to travel unless they absolutely need to from their local area. We want to work with patients to find solutions to modernise our healthcare service to provide 7 days a week high quality care.
I deal with operations or patients who have had injuries to the face, including hard tissue and soft tissue, but also deal with people who have cancers of the mouth and face. Quite a lot of specialist services are already centralised in East Kent. The head and neck cancer service is centralised at the William Harvey Hospital, vascular surgery is centralised, urology services are centralised, and complex heart attack services are centralised as well. We can't have these services in every hospital because these are very specialist teams comprising of surgeons, theatre teams, ward nurses and therapists. But the specialist centre is still in East Kent, it's not travelling to London.
The emergency department is all about saving lives. We see the sickest patients first, and those who are less unwell will need to wait. To be honest, they're better off being treated elsewhere within the local NHS, such as their GPs and urgent treatment centres. And that enables us within the emergency department to deliver the highest quality care to the critically unwell. Saving lives is our main priority.
When I started, we didn't have a frailty team, so we are now the community frailty team who work across Canterbury and Ashford, and we look after people in hospitals, in the community hospitals, we look after people in their own homes, and we do quite a lot of work in care homes as well. At the moment we invest a lot of money in our hospitals, and people are in those hospitals for much longer than they should be for various reasons. It's just we have developed a system which means people stay for a very long time, a lot of the time, and people don't get better in hospital often, they often get worse, particularly in the context of dementia, because people with dementia will often get much, much worse. It's very frightening to be in hospital.
I tend to see really complex patients who have high needs in terms of frailty, and within that we see a number of patients who have long-term conditions, including dementia. The right thing to do is to get you home, because all you're going to get by being in hospital is more muscle wasting and the risk of more infections, and actually the loss of your independence.
What I think is necessary is that we invest in our community services to allow people with frailty to stay at home and not be endlessly in and out of hospital.
We understand that change can be worrying, but what we're trying to do here is to enable as many patients as possible to be seen as locally as possible.
If the case for change allows for more people to be at home and good proper care being provided for them at home, then that would be the outcome that I would want.
It's really important that we understand the patient's viewpoint in all of these changes we're trying to make, because ultimately that's what it's about.